Welcome. This is Beating the Healthy Diet Barriers by Group 18. With the rise of childhood obesity in North America, the risk of type 2 diabetes can evolve into a worldwide public health issue. This can cause a significant burden to our health system and our society. So our introduction is to share a healthy diet. A healthy diet is an eating pattern to provide enough of each essential nutrient and focus on balancing calories consumed with calories expended to achieve a beneficial weight. We chose our target population to be low-income elementary schools in San Diego County. This intervention is not just about eating food. By acting first and instilling children with excitement, we can motivate them to have good health behaviors. Research has shown that there has been a rise in obese adolescents during 2017 to 2020. Statistics have shown that 62.1% of children in San Diego has not been eating enough portions of fruits and veggies. We believe there is not enough education and choices around food due to the lack in funds. So our hypothesis is that by offering more healthy options with the teachings of nutrition, there will be a greater consumption of vegetables and fruits and an improved BMI from baseline to 5 months.
Our intervention will be a collaborative project between parents, staff, and students. Guardians of the children will be given a brochure to inform them about what a healthy diet consists of, healthy meals to cook, and facts and statistics related to disease and health. Teachers would show videos to their students and also integrate games into their methods of enlightening students to make better food choices. A game example could consist of food trivia, where students are introduced to food options. Students would be later on rewarded for choosing and consuming healthier options from the school cafeteria. We are using the social cognitive model because it relates to an individual acquiring knowledge through observations and social interactions. On the individual level, they will learn what is considered healthy, having a positive attitude towards healthy eating, and being open to trying new foods. On an interpersonal level, it is important to focus on social networking since the students are strongly influenced by their peers, by having family and friends set a good example and being role models. The students are more prone to following these examples. Home and schools are the main area of concentration for our intervention since this is where the students spend most of their time in.
For our evaluation plan, we will begin our process by having teachers implement hour-long sessions twice a week. These sessions will consist of educational content that warns children of the dangers of unhealthy diets and encourages healthy eating, all while being fun and interactive. With these sessions also come home assignments that are encouraged to be done with said child's parent or guardian. To evaluate the effectiveness of these activities, we will have parents fill in weekly reports with their child and observe any changes in behavior or attitude. We will utilize a validated dietary questionnaire to see our outcome. The food frequency questionnaire will show us if there is an increase in fruit and veggie consumption, as we will be taking data before and after our intervention. Because our targeted population consists of overweight and obese students, we want to measure the BMI in order to assess the risk of chronic diseases based on the student's current weight. With continued fruit and vegetable intake and overall healthier food consumption, we expect our impact to bring a child's BMI to their relative height and weight. This is an easy measure as it can be taken in a nurse's office and can be done in order to make sure a child is on the right track. With our logic model, we would first like to address our health issue, which is obesity and being overweight. Factors that contribute to this chronic disease are lack of healthy foods and poor nutrition. This increases the risk of type 2 diabetes and cardiovascular disease. How do we alleviate or solve this problem? With our intervention, which can be found in the output box. We will be providing brochures to parents, holding weekly activities, and using the food frequency questionnaire to access nutrition data. Found in our inputs, we will be using parents, teachers, the school district, and funding to help with our intervention. Our short-term outcomes will consist of reduced intake of unhealthy foods, more fruit and vegetable consumption, positive attitudes regarding healthy options, and a BMI conforming with healthy weight. If our intervention is sustained, we will see long-term impacts of decreased risk of type 2 diabetes and other chronic diseases, improved diet, a foundation of good health, and a maintained healthy weight. This concludes our presentation of Beating the Healthy Diet Barriers by Group 18. Thank you for listening.